For the first time in 20 years, the FDA has approved a new sunscreen ingredient called bemotrizinol. And joining us now to explain what that means for consumers and to share some skin and safety tips, Dr. Mohiba Tareen joining us here on the show. Dr. Tareen, we appreciate you taking the time. Thank you so much for being here.
Thank you for having me, Pierre. I'm so excited about this new development to save all of our Minnesotans, who we are now #2 in the nation for rates of melanoma.
Is that right?
Really need this new ingredient.
#2 in the nation for melanoma. Why do you think that is?
So the studies have actually shown it's because we have a very Caucasian population, we have a very active population, and unfortunately, we do have like this episodic sun exposure versus climates that are always exposed to the sun. When we have that first April sun, you see everybody in their shorts outside, right?
Oh, I pay for it. Listen, I was born and raised in California, and I've lived here for 8 years now, and I say to myself every time, I still have that California mentality. I go outside, I play around for 4, I don't need any sunscreen. I take one step outside when it's May, and I pay the price the day after. So this is something that I'm still getting used to be honest. The FDA, like we mentioned, just approved its first new sunscreen in about 20 years. Why is that a big deal?
Huge deal, because in the US, unfortunately, we are really behind in sunscreen. A lot of these sunscreens that have longer UVA filters have been approved in Europe for over 30 years. For example, this ingredient, bemotrizinol, was approved by the European Union in 1999. So they've had it for almost 30 years. We know it's a great ingredient. It's stable. It gives you really good protection, and it lasts a little longer. And more importantly, for all of us moms, it's not absorbed into the skin like a lot of other sunscreens. So there's minimal skin absorption.
Oh, interesting. Okay. And so what is bemotrizinol? You said the Europeans adopted it and have had it since 1999. So what exactly in it, and what's different about it, I guess, than the sunscreens that we see here in the United States?
Great question. So it is a chemical blocker. So it's quite stable compared to some of those mineral blockers. And the thing that's different about it is that it has longer UVA protection. So there's kind of two types of rays we get from the sun, UVB and UVA. And the way that you can easily think about it, UVB is burning, B for burning.
Okay.
And American sunscreens typically are actually pretty good at protecting against the B burning rays. UVA is aging. So those are longer wavelengths of light. They get deeper in our skin, and they cause aging and contribute to skin cancer. Both contribute to skin cancer. But now we have this new ingredient that will actually help protect us from aging and help protect us from skin cancer. And it's a little longer lasting, and it's not being absorbed into our skin. So it's a win-win for US consumers.
I was about to say, that sounds pretty good to me. I don't know how you can argue with that. Grace, our producer, I know had a question too. Grace, what do you have for Dr. Tareen?
Kara and I we're both back here going, when can we get our hands on this anti-aging? We're in our 20s, so we're still young, but we still want to get our hands on this. When can we expect to see this sunscreen containing bemotrizinol, however you say it, on the market?
Yeah, so you can call it BEMT. In Europe, it's also known as Tinosorb. So if you are going to Europe or Mexico or something like that, you can buy this already, Grace.
Okay.
So it was FDA approved on June 9th, so like literally just the other day.
Wow.
Companies anticipate they'll have it on the shelves end of summer, unfortunately, but it will be a great option in the sunscreen aisles. I'm really excited, especially for young people like you. It will help prevent against brown spots and both the medical and the cosmetic aspects of the sun.
I'm going to love that. I'm in my 20s too, Dr. Tareen. Yeah, so I can't wait to apply. No, that's a total lie. What I would like to know, though, in your experience and all your years of working in this profession, working in this field, what's some of the biggest mistakes you think you've seen families making when it comes to protecting yourself from the sun, protecting your family from the sun? What are some of the tips that you would like to see families, or some of the things you would like to see families adjust, change? What tips do you have for them?
So a couple of main ones. Number one, a lot of people think of sunscreen as just like a one-time thing. You put it on in the morning, you're done for the day. That is a total fallacy. This is something, especially when you're out on the lake and things like that, you have to keep reapplying, because the studies are actually done. Like if you're getting SPF 30, SPF 50, that's really done with reapplication, Pierre.
Okay.
Number two, and this is also a big fallacy, this BEMT and all the other chemical sunscreens, they actually have to be applied 15 to 30 minutes before you go outside so that they get into your skin cells and form that protection. So if you're going outside, you put on your sunscreen, you go outside right away. Guess what, guys? You are getting sun damage, you're getting DNA damage, you are burning. So make sure to put your chemical sunscreen on 15 to 30 minutes before you go outside. Many of you kind of watch and listen to experts and you're using mineral sunscreens like titanium or zinc, and the fallacy for that is that it gives you protection right away. No, for those, you also have to wait just a couple minutes, maybe 2 to 5, and that will give you full protection. So it's really important to put on your sunscreen, anticipate before you go outside. And number 3, the most important tip I want your viewers to take away is sunscreen is just an adjunct, guys. Hats, sun protective clothing, going out in the shade during the hot midday sun. Those are your most important things. We never rely on chemicals.
So I wear like a skin tint that has SPF in it in my face. Is that something that I should be reapplying, even if like during my workday? I'm not outside a ton. I'm outside in the morning in the car, and then I drive home, and maybe I'm outside in the evening. Should I be reapplying, just my makeup skin tint that contains SPF, or should I be wearing like a product that's just sunscreen lotion or a sunscreen product?
So the studies have actually shown when we as women wear skin tints and makeups, we're putting on such a thin layer, we're actually not getting the SPF that's on the label, Grace. So we recommend as dermatologists, put on your sunscreen first and then put your skin tint on top of it. And breaking research shows the skin tints are actually really good for us because visible light can actually cause pigmentation issues for some people who are prone to a condition called melasma. So it's really nice to have that sunscreen base and then skin tint on top of it.
What are some indications of skin damage from the sun? Like I, in the summer, get a lot of freckles on my face when I spend time in the sun. And I try to be pretty good about, wearing sunscreen and wearing the skin tint and hats and stuff. But are these freckles a sign of skin damage, or what are some other signs that people should be looking out for?
So it sounds really ominous, but any darkening is actually DNA damage. So the sun has come into your DNA and caused a pigment production that then breaks some of the DNA fibers. I mean, we all need sun. The studies have shown it's important for mood and affect, and actually people who get no sun have higher risks of overall other cancers. So we as dermatologists are not here to preach no cancer, but any pigment is a little bit of DNA damage. So maybe you should be a little bit better about your hats and kind of those physical blockers, Grace.
Grace, I'm actually glad that Dr. Tareen said that in terms of the mood, because that makes a lot of sense. Because Dr. Tareen, I'm in a bad mood from about November all the way till about, I'd say, June 1st here living in the state of Minnesota. So that makes a lot of sense. I don't really see the sun as much, but as somebody like me who likes to be out in the sun a lot and likes and probably waves his wife off when she tries to remind him to wear sunscreen all the time. Like, yeah. But that's probably not a great thing to do, because obviously we don't want to go to the extreme, but skin cancer is something that is certainly a reality of our world. What are your suggestions for preventing people from getting to that final point, really, before it's too late?
Well, everything in moderation. You're right. You need that mood and affect kind of sun. Make sure you're getting enough vitamin D. So again, as dermatologists, we recommend a little bit of sun, but also getting your vitamin D from a multivitamin or, just taking vitamin D3. But men, we know in Minnesota, have a much higher rate of melanoma, unfortunately, Pierre. So
Right.
make sure you're also getting your skin checked. So go out in the sun a little bit, wear your hats, wear your sunscreen, but get your skin checked too, because we don't want you to be one of those statistics. Not that you're 50, but men over the age of 50
I'm
have
getting there.
80% higher rate of melanoma
Is that right?
than women. It's insane. So men should get checked. Their melanomas are found later and found worse with a higher mortality.
And like you said, in terms of getting your skin checked, I know a lot of young people, I should say, that's not something they're probably thinking about. But in terms of getting your skin checked, what are some of the things when you go to the doctor? What kind of questions maybe should you be asking in terms of what should I be looking out for my skin and my skin's health?
Well, there's a really great mnemonic. It's called the ABCDEs of melanoma. If you have anything that's asymmetric, funny border, funny colors, big diameter, and most importantly, evolving. So it's interesting, many people don't know this, but you should not be getting a new mole after the age of 30. So if you have a mole that's come up after the age of 30 that's not going away, it may be at higher risk and you should get it checked.
Okay.
Is there any sunscreen that you could really recommend? Is like any sunscreen, is there a brand that we should be watching for? Is there a specific SPF that's the best? Or is it, I've heard some sunscreen is better than no sunscreen. Is that true?
That is true. I always tell my patients, that's probably my number one question as a dermatologist for 20 years. The best sunscreen is the sunscreen that you will wear. That's why there are a myriad of them. try them, see what's light, see what feels good on your skin. They're like for my rosacea prone patients, we actually recommend green tinted sunscreen because green is opposite of red on the color spectrum. So then they have to wear less makeup. For, brown skin people like me, we do recommend sometimes a pigmented one because they don't look as white when they put them on. So again, the best sunscreen is the one that you will wear.
Okay. Well, Dr. Marine has certainly given me a lot to think about before I go to the pool next time coming up. Dr. Tareen, we certainly appreciate your time. Thank you so much for your expertise. Where can people find your work? If you have any recommendations or tips, where can they find it?
Well, we're at Tareen Dermatology and we have 11 locations across the state of Minnesota and 2 in Wisconsin. We're excited to take care of all of our patients and provide them with really comprehensive skin checks and prevention.
Dr. Mohiba Tareen, we appreciate your time. Thank you so much for joining us here on Fox 9 All Day.